My name is Lauren Masi, Doctor of Physical Therapy and Board Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about car ergonomics. So how do you fit in your car and the setup and how it might affect your pain and your posturing. So ergonomics is how you fit in your environment. Not all cars are created equal. As you can see today, I'm in an SUV, which can make getting in and out of the car easier compared to a sedan. And obviously, I have had some patients who've actually picked their car based on their physical ailments, but once you get into the car, the actual setup of the seat position, steering wheel, all of that is about the same between a sedan and an SUV. As I've mentioned in other vlogs about ergonomics, please listen to this whole video to see how one piece connects to the next, so then you can see which areas you might need to fix for your particular complaints or ailments, and if we can't modify everything perfectly, we can make the appropriate decisions. As a physical therapist, a lot of my patients complain about back pain and sometimes shoulder pain and neck pain while driving. Those are the most common complaints. And with back pain can also be some hip discomfort. So the first thing I want to talk about is the seat position itself. Now, newer cars obviously have a lot more bells and whistles and might have adjustments like these on the side that can actually control the angle of your seat pan, so where my butt is sitting. What we're looking for is that is as close to horizontal as possible. So I have a feature that can actually tip it down where my butt would get lower than my hips, or tip it up. Then we get to a point where maybe I can't tip it enough. If that's you, or if your car does not have that kind of seat adjustment, what I recommend doing is taking a large beach towel and try folding it and putting it only in the back half under your tush here. So that can lift your butt up relatively to make your thigh more parallel in the seat. When it comes to the seat back, you don't have to be bolt upright. This is actually how I sit in my car, and it is super comfortable for me. I love to use the back seat of my car to support my spine so I don't have to hold myself up. But the target would be between 90 and even 120 degrees of angle in that part of your seat would be acceptable. Make sure that your butt is all the way back into that part of the seat when you sit down. You don't want to have your butt really far forward, as that will cause the rest of your body to slouch. So getting your butt all the way back so you can use that backrest. Another thing that can contribute to your thigh position is whether or not you keep your foot on the firewall. You really should keep that foot extended to that hard piece of plastic on the lower left, as I have it right now while I'm driving. If I don't, and I bring my foot back here, just note that that might raise your knee enough that it could cause a little bit excessive bend right in the hip joint there, which could lead to some discomfort. Then, how close or far you are from the steering wheel. Some people might, when they get their seat back more upright than they normally have it, feel like they're too close to their steering wheel. So per the Department of Transportation Safety, you need at least 12 inches for the airbag to safely deploy in the case of an accident. So sometimes, as I mentioned, having that seat upright, you might feel too close, but just know that that's a guideline to be aware of. What I really want to make sure is that you aren't so far away that those shoulders are reaching forward off of the backrest. And a quick test that I do is I'll have you drop your hand over the top of your steering wheel right in that wrist crease. And you're trying to make sure that in order to do that, it's not pulling your shoulder blade off of the back of your seat. Now, old school rules for driving said hands at 10 and 2. They now say that 9 and 3 is acceptable. The thought being that you want to just make sure that your arms hang loosely and relaxed and you're not having to lift and hold your arms up. If you are having any pain or you're recovering from any shoulder surgeries, you have the option to come a little bit lower as well, as long as you feel like you are safe. When it comes to headrests, the final touch that I want to mention today, certain headrests, especially newer cars, in my opinion, are terrible because they angle towards your head and it sometimes makes you feel like it's pushing your head forward. Again, the reason they do it is they want your head to be in contact with the headrest immediately so that if you are in a car accident, there's no whiplash effect for your head to go farther back. So they have started to angle headrest towards you a little bit. This is a non-approved correction, but I'm going to throw it out there for some people if it's absolutely necessary. Some car headrests can come all the way out if you push the little button. The reason it's not approved is if you take it all the way out, what I want you to do is spin it around so that the flat side is what's contacting your head. Do put your headrests back in. They are critical to protect your neck in the case of an accident. But the reason it's not approved is the little click-in portions don't always work both ways. So in a rollover accident, that potentially could come out. But temporary fix if you're having a lot of neck pain, you could consider doing that. Or you might need to get a full back pillow cushion that would scoot your whole body up a little bit so that even with the forward angle of your headrest, you would be in a straight plumb line. So you'd be bringing, in essence, the back of the chair up to meet you and filling in that gap with your headrest. Okay, I think we've covered most of the touch points for ergonomics in your car. If you are having any pain in your car seat, please try to make some of these adjustments. And if you need further assistance, please reach out to us at Bay Area Physical Therapy for a complimentary consultation today. Thank you so much.